Join me as I take on the challenge of boosting my upper limb recovery after a stroke using these exercises. Upper limb recovery after a stroke is a crucial aspect of rehabilitation. It's an area that can have a significant impact on a person's quality of life, and it's often overlooked. As a stroke survivor, regaining motor function in the arms and hands can be a daunting task, but it's essential for performing everyday activities and maintaining independence. The good news is that with consistent practice and the right exercises, significant improvements can be made. In this video, we're going to explore some effective exercises designed to enhance upper limb recovery, as well as discuss common challenges and solutions. Recovery from a stroke requires a holistic approach, and it's essential to address the physical, emotional, and psychological aspects of rehabilitation. By focusing on upper limb recovery, we can improve overall mobility, balance, and coordination, which in turn can enhance our overall well-being. As we dive into the exercises, it's essential to remember that every stroke survivor's journey is unique, and progress may vary. Be patient, stay committed, and celebrate small victories along the way. A stroke occurs when the blood supply to the brain is interrupted, either due to a blockage or a bleed. This can cause damage to the brain cells, leading to a range of physical, cognitive, and emotional impairments. The effects of a stroke on upper limb function can be devastating, from mild weakness to complete paralysis. According to the American Heart Association, approximately 800,000 people in the United States experience a stroke each year, with 25% of those resulting in significant impairment to the upper limbs. The good news is that with proper rehabilitation, many stroke survivors can regain significant motor function. In fact, research has shown that early and intensive rehabilitation can improve outcomes for stroke survivors. The key is to start rehabilitation early, and to make consistent progress. In the next section, we'll explore some exercises designed to target specific muscles and movements. Let's move on to the exercises. The first exercise is the shoulder flexion exercise. This exercise targets the deltoid muscle, which is responsible for lifting the arm. To perform this exercise, stand with your feet shoulder width apart, and lift your affected arm straight out in front of you. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The next exercise is the shoulder abduction exercise. This exercise targets the deltoid muscle, which helps to lift the arm out to the side. Stand with your feet shoulder width apart, and lift your affected arm out to the side until it's at shoulder height. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The bicep curl exercise is another effective exercise for upper limb recovery. This exercise targets the bicep muscle, which helps to bend the elbow. Stand with your feet shoulder width apart, and hold a light weight in your affected hand. Curl the weight up towards your shoulder, and then slowly lower. Repeat for 10 to 15 repetitions. The tricep extension exercise targets the tricep muscle, which helps to straighten the elbow. Stand with your feet shoulder width apart, and hold a light weight in your affected hand. Extend the weight straight out behind you, and then slowly lower. Repeat for 10 to 15 repetitions. The finger bend exercise is an excellent exercise for targeting the muscles in the hand. Place a small towel or washcloth on a flat surface, and practice bending your fingers to grasp the towel. Hold for a count of 5, and then slowly release. Repeat for 10 to 15 repetitions. The finger extension exercise targets the muscles in the hand and forearm. Place a small towel or washcloth on a flat surface, and practice straightening your fingers to release the towel. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The wrist extension exercise targets the muscles in the forearm. Hold a light weight in your affected hand, and practice lifting your wrist up and down. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The forearm rotation exercise targets the muscles in the forearm. Hold a light weight in your affected hand, and practice rotating your forearm in a circular motion. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The elbow flexion exercise targets the muscles in the upper arm. Hold a light weight in your affected hand, and practice bending your elbow to lift the weight towards your shoulder. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The shoulder rotation exercise targets the muscles in the shoulder. Hold a light weight in your affected hand, and practice rotating your shoulder in a circular motion. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The supination exercise targets the muscles in the forearm. Hold a light weight in your affected hand, and practice rotating your forearm so that your palm faces upwards. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The pronation exercise targets the muscles in the forearm. Hold a light weight in your affected hand, and practice rotating your forearm so that your palm faces downwards. Hold for a count of 5, and then slowly lower. Repeat for 10 to 15 repetitions. The grip strengthening exercise targets the muscles in the hand. Squeeze a small rubber ball or hand grip for a count of 5, and then slowly release. Repeat for 10 to 15 repetitions. One of the biggest challenges faced by stroke survivors during rehabilitation is motivation. It can be tough to stay committed to a rehabilitation program, especially when progress is slow. Another challenge is accessibility to resources. Not everyone has access to physical therapy or rehabilitation centers, which can make it difficult to get the support and guidance needed. Physical limitations can also be a significant challenge. Many stroke survivors may experience fatigue, pain, or limited mobility, which can make it difficult to perform exercises. Despite these challenges, it's essential to stay committed to rehabilitation. With the right mindset and support, significant progress can be made. So, how can you overcome these challenges? One strategy is to find a workout buddy or support group. Having someone to hold you accountable and provide motivation can make a big difference. Another strategy is to set realistic goals and celebrate small victories. Break down your goals into smaller, manageable tasks, and celebrate your progress along the way. It's also essential to prioritize self-care and rest. Rehabilitation can be physically and emotionally exhausting, so make sure to listen to your body and take breaks when needed. If you're struggling to access resources, consider reaching out to local nonprofits or online support groups. There may be options available that you're not aware of. Staying motivated and committed to rehabilitation requires a mindset shift. It's essential to focus on progress, not perfection, and to celebrate small victories along the way. In this video, we've covered some essential exercises for upper limb recovery after a stroke. Remember to start slowly, be patient, and stay committed to your rehabilitation program. Consistency is key when it comes to rehabilitation. Aim to practice these exercises 2 to 3 times a week, and gradually increase the frequency and intensity as you progress. Don't be afraid to reach out to healthcare professionals or online resources for support and guidance. Remember, you're not alone in this journey, and there are people who care. As you continue on your rehabilitation journey, remember to stay focused on progress, not perfection. Celebrate small victories, and don't be too hard on yourself. If you're looking for more information on stroke rehabilitation and recovery, I encourage you to do further research. There are many amazing resources available online, including videos, blogs, and support groups. Thank you for joining me on this journey, and I wish you all the best on your path to recovery.